Supervisors are responsible for correcting unsafe work conditions. They do this by understanding the problem and taking action. The following video shows how a supervisor puts in place work practices and interventions to minimize the risk of staff exposure to a possible infectious disease.
It is now confirmed that a deadly superbug that has spread through this long-term care facility has caused the deaths of 3 seniors over the past week. 21 other seniors have also fallen ill. Preliminary reports indicate that some staff members have also come down with symptoms, 2 of them serious enough to require hospitalization. Although the source of this outbreak has yet to be pinpointed, there are growing concerns that a new strain of this disease may start spreading throughout this community. This is Vicki Chalmers reporting live for Channel 8 News.
Kim, something isn't right with some of the residents. The fever and diarrhea that Mrs. Smith came down with yesterday seems to be spreading.
How many people are we talking about?
Well, Mrs. Newell, Mr. Higgins, Mr. Chan, and of course Mrs. Smith. It appears to be contained to C-Wing.
Okay, this could be a problem. It sounds like we might have an outbreak on our hands. Before anyone else gets sick, we need to put some procedures in place.
Okay.
Can you please go and tell the staff from C-Wing that I want to meet with them in about 15 minutes to go over procedures? We don't want more residents getting sick, and we also need to protect the staff. Since I'm in charge today, it's my responsibility, so I will call the Director of Care and go over the procedures that we need to follow. I also need to contact Public Health.
Okay, I'll go and get everyone.
Thank you. Okay, as everyone likely knows by now, 4 residents on this wing have come down with similar symptoms over the past 24 hours. I'm concerned that we have the start of an outbreak. Because I'm in charge today, I need to make sure that we protect both residents and staff. I'm going to limit the number of staff that are assigned to care for these 4 sick residents. This is so we minimize the risk of contamination between the sick residents and those that are not ill. Those not assigned to care for these sick residents are not permitted to enter their room. I will be posting GI precaution signs on the doors of Mrs. Smith, Mrs. Newell, Mr. Higgins, and Mr. Chan's rooms. The sick residents will also need to remain in their rooms until further notice. Okay? Okay.
Is that okay?
For those assigned to provide care to our sick residents, I want you to use routine practice and wear gloves and gowns. And a reminder to everyone, wash your hands before and after providing care to anyone. Barry, can you alert housekeeping and let them know that we have a potential GI outbreak on our hands? I'll be able to give them more information once I've spoken with infection control and get further directions. I will contact the on-call doctor and get direction on how to care for the sick patients. Last thing, we'll need to restrict visitors until we have a clear picture of what's going on. Please explain to the family and visitors that this is for everyone's best interests. Please take the time to protect yourselves. Follow the infection control protocols I've outlined and posted to the doors of the rooms, and ask for help or information if you have any concerns. Simi, I'll come help you as soon as I've spoken with the doctor.
Okay, thank you.
Okay. Thanks a lot, guys. And Candace, I just wanted to go over this with you quickly.
You just saw Kim, a supervisor, act to protect the health of both her staff and the facility's residents. She made sure that the staff knew what they had to do and how to protect themselves. She also confirmed that safe work practices were being followed. When figuring out how to control a hazard, consider the information you gathered when looking at its cause or source. Remember, you must communicate information to your staff, make sure that they are able to implement the control measures, and update all necessary documents.